My name is Nancy Gray with Liberty University, and my practicum is called Evaluating the Effectiveness of the Supervisor at the Bong County Health Department. Liberia is located in West Africa. It's one of the poorest countries in the world. This is the result of multiple civil war, government instability, poor infrastructure, and government mismanagement. The population is approximately 4.1 million people. Liberia has had 14 years of civil war, which demolished the healthcare system, destroyed the livelihood of many survivors, and killed tens of thousands of people. During the war, 80% of the clinics across the country were destroyed. Personnel fled, and leftover resources were looted. Bong County is located in Swakoko, Liberia. It was established in 1964. They have 42 health facilities. Out of the 42 health facilities, there are 3 hospitals, Bong Mines, Charles Burgess Dunbar, and Phoebe Hospital. There are 38 forensic clinics and 1 proposed health center, Bellafina. The county has a population of a little over 400,000 people and 8 health districts. The Bong County Health Team and their health partners, Management Science of Health, Africare, International Rescue Committee jointly conduct field supervision. They are to conduct field supervision of 75% of the 33 health facilities, but many times the county falls short of its targets. Bong County Health Teams is among several in Liberia that do monthly supportive field supervision visit as recommended by the Ministry of Health. That is instrumental towards the implementation of essential package of health services. The problem is there seems to be a lapse in protocol implementation resulting in preventable loss of life. Could the reason be are not being followed, supervision is lacking, relationship between employee or director. The protocol is not being followed, diseases can be prevented. A good example would be a few months ago, approximately 2 to 3 months ago, there was 3 deaths reported for children within the county due to measles. Now the problem with that is if one child died of measles, protocol should have been put in place to immediately go to that facility, go to that village, and make sure everyone is treated. Somehow there seems to be a lacking in protocol information being translated between the workers. I'm not sure at this point whether it's from the supervisors to the employees to the county health workers in the village. So this is one of the reasons. So I wonder, will procedure follow? Was it a lack of communication? Was it a lack of resources? Was it a lack of knowledge for procedure? Was protocol followed? That is what we have to try and find out. The aim of this study is to identify factors that contribute to the ineffectiveness of the supervisors. A cross-sectional study was done to solicit program supervisors' view on supervision activities, clinical report, and supervision report from their field supervision. National field supervision guidelines was used to triangulate information and avoid bias. So out of the 50 supervisors, we were able to solicit sample size of 44. The sample size was analyzed using descriptive statistics such as bar chart, cluster bar, cluster column, and chi-square tests. The result of the questionnaire, based on the questionnaire that was distributed to the supervisors, the results showed that the ineffectiveness of the supervisor was not due to the misconduct on their part. Rather, factors beyond their control determined to be the reason for the ineffectiveness. Factors influencing, based on the chart that you can see, some of the factors that influence the ineffectiveness was actually due to logistics, funding, staff and support, access to fuel that leads to the ineffectiveness. So when they go onto this field, when they go into the field supervision, they require staff that is beyond their regular job. When they go, they're going for days at a time. They don't just go for one day. They go to these villages. You can only go so far, then you have to walk in the rest of the way. And some of these villages, they have to be there for 2 or 3 nights at a time. So they do need money for food. They do to be able to find some food. Another way for them to get there is through maybe bike or car. So at this point, they do need gasoline. So they don't have the gasoline available, and they don't have the money for funding. The director they don't have this information. They don't have the money and supplies they need. They cannot be effective in doing their duties. This is hindering them from doing what they need to do. So the good thing about this study is the strength of the study. A high percentage of the supervisor participated in the survey, so that you got accurate information, we got up-to-date information. Also, one of the good things about the study was showing that the major cause was funding. Funding was not coming down from central office. Logistics and procurement was all part of the lack of ineffectiveness, the lack of them being effective in doing their duties. One of the limitations with this study is the fact that not all the supervisors participated in the questionnaire because I only did a sample test. And another thing is, if this had been done a while ago, maybe a year or 2 ago, they would have been it would have better procedure in place to accommodate these supervisors that go into the field. They would have better funding for them to have the money available to them. Because truthfully, a lot of these times, these supervisors, I have seen sometimes do not even get paid right away. Some people are very fortunate in other places to get paid. When you work, you get paid. Some of them do not get paid. Some of them go sometimes months without being paid. But they're still doing their job. They're still there working. So my recommendation would be to make sure that Central, the Ministry of Health, the central government, make sure they supply the different counties what they need with the gasoline or with the funding, whatever supplies they need to make sure that it's on top of things, make sure it's getting to these people on time so they can continue to do the work. Because truthfully, if this, for example, measles, it could be measles, it could be Ebola, it could be any disease. Some of these diseases are very contagious. And just have to be able to get into these villages ASAP in case of emergency. And when these things spread, you have diseases that spread easily. And when it spread easily, that could lead to death. So you have some of these things that is very deadly, extremely deadly. And if they don't get to work on it on time, not only, that could wipe out villages. For example, Ebola killed thousands and thousands and thousands of people. It doesn't even have to be anything that bad, but just a simple thought. If they do not have what they need to function, that could lead to death or the spread of diseases. And in the future, what I'm actually looking at, thinking about doing, is I actually would like to go back and compare Bong County with some of the other counties, see how they manage, see what other counties are doing. Because actually, truthfully, Bong County are one of the top counties in Liberia right now. Their hospitals are top notch. They are very advanced compared to some of the other hospitals. So I would like to compare them against some of the so I would like to compare Bong County health facilities, against other health facilities to see how they mention up. But bottom line, central government and Ministry of Health just need to make sure the supplies and funding the people are getting what they need to make sure they're effective in doing their duties. Thank you.